So, Rudy, I'm going to ask you to hang out in the background for a few minutes, and I am going to pull in Dr. Sue Varma.
Hi, Mark. How are you?
Hi, I'm very well. It's so nice to meet you in person right now for the very first time.
Yeah, thank you so much for having me. What a great cause. I'm so excited to be joining you.
Thank you. So I wanted to bring in because our producer Rudy, who's off screen right now, is based in Los Angeles. I wanted to have a bit of a cross-border flavor to what we're doing here because although Bell Let's Talk has been into its 10th year now, it's it is, I think, the largest awareness and fundraising campaign specifically dedicated to mental health in the world. They've raised over $100 million so far for mental health initiatives across Canada. It has been picked up in many other countries around the world. It's often a global trending topic, with the idea being that we need to talk, and this year in particular, we need to act as well. So for American listeners who know you but don't know about this, I wanted to give that bit of context. For our Canadian listeners who may or may not know the work that you do, why don't you tell us a little bit about yourself, what you're passionate about, and some of the things you've done?
Sure. Yeah, so I'm a private practice psychiatrist, board certified in adult psychiatry, and I work with people across the life cycle. So I have people coming to me in their early teens and 20s, dealing with first jobs, relationships, navigating job promotions, starting a family, to people well in their 50s, 60s, 70s. I happen to be a cognitive behavioral therapist, and it is one of the most well evidence-based studied types of therapy. What I love working with people so much, and why I became a doctor and why I became a psychiatrist, is I think our first role fundamentally is education. And to me, this type of therapy is very empowering. It allows a person to feel like a client, not necessarily a patient at the mercy of this omniscient doctor, which, by the way, we're totally not. As much as we know, there's so much more for us to learn. I also work with couples and couples therapy and medication management when I think it's necessary. But my whole aim is having to get a holistic picture on somebody. And I do believe in the role of diet, nutrition, exercise, yoga, and mindfulness. I think that there's so many things that people can do on their own. Connection. One of the things we're talking about now is the loneliness epidemic, and breaking stigma barriers. Before I got into private practice, I was working with victims of 9/11. I was the first medical director of the 9/11 mental health program in New York City, which was a center of excellence, one of the three. So I wear many hats. I also teach at the medical school about how to interview medical psychiatric patients, and I do a lot of work with the media. We had a huge Stop the Stigma campaign with CBS. So I'm really excited to be talking to you guys about this. And I think it's so amazing, even just the little, breakdown on social media that you had about what is stigma and the pieces of it in terms of education, really, I think is very inspiring, and it gives somebody something very concrete and tangible to work with.
Yeah, so I want to touch on a number of things you just said because I think there's a lot packed in there. But I want to start with the media piece because I think that's so relevant to Bell Let's Talk as a public awareness raising initiative. I think I've seen that you've been everywhere. I mean, you've done the Today Show and I think GMA, and you mentioned this campaign for CBS. Can you talk to me more about some of that work and maybe how it's evolved since you first started doing it?
Sure, yeah. So when I first started talking, in medical school and even before, I've always been interested, as I said, in terms of education component of it. And I wanted to be able to reach mainstream audiences. So, even though I was involved in a lot of academic papers and presentations, we have to get the word out on the street. And what's very interesting to me is that psychiatry was actually not one of the chosen professions if you were a medical student, right? I think in my class of maybe 180 graduating, maybe 4 to 6 people have gone into psychiatry. And I think things have changed. I think that we were always considered, the stepchild. If you look at any psychiatric any sort of medical facility, the psychiatric wards are always in the back on the top floors. So in general, it was a profession that, people were scared of. And even when I would tell people at parties, I want to say 15 years ago or 20 years ago when I was getting my education and I wanted to go into psychiatry, people would be very scared if you met them socially to be like, what does that mean? Are you analyzing me? Right. So I think that there was a lot of myths and misconceptions. So my interest in the media began with the idea of educating. And through my work with the 9/11 mental health program, I was also very involved with the American Psychiatric Association. I'm a distinguished fellow and have done a lot of service with them over the years. I through that work, the media would start to call and say, can you talk about a variety of topics? And I've probably done 500 to 600 television interviews in the last 12 years and numerous other, for print and editorial. But I think it really is an honor to be seen as somebody who can be able to talk to both, the peers, and then also to be able to relay that information. And I think more and more doctors are doing this. A lot of doctors are on social media nowadays. And so I think it's evolving into, and we have to develop a language to be able to break it down, to make it simple. We have to practice it in our own lives. Patients can very, clearly call you on your stuff. Like, doctor, when's the last time you took a vacation? So I try to incorporate some of that work-life balance and some of the advice that I give to my patients.
Yeah, I think there's so many key issues here, and especially around, the how you talk about and raising awareness of mental health in the media. It seems like maybe this is more common in the US than in Canada, though it's still very common in Canada too. The vast majority of times that media reports on mental illness and mental health problems is in relation to violence. And in the United States, particularly gun violence and mass shootings. Is that what you would be called on early on? And is that still what you get called on?
That's so interesting because yes. And, to your point, like the reality is that people who live with mental illness are probably 10 times more likely to be a victim of a violent crime than the perpetrator. And, typically I would say school shootings and suicides are kind of the thing that come to people's mind of like, when would we, invite a psychiatrist as a guest on our show? And, but I definitely see that over the years it's evolved, and I talk about a lot of things in terms of social media use and its effect on our brain. I had talked about depression and anxiety, postpartum, I think is a big area. I'm very interested in prevention, and I think it's so wonderful what you guys are doing in terms of raising money and going, sort of contributing to different aspects. When you look at the life cycle, I feel like if you want to change, a new study came out about the single biggest predictor of psychiatric illness is childhood adversity.
And I just saw that myself, yeah.
Yeah, so putting money early on. And so I talk about such a wide range of things: pop psychology, travel trends, wellness, people taking vacation. So it could be the darker side of what we're dealing with, but also the sort of lighter mainstream side: relationships, toxicity, everyday stuff.
Yeah. No, several years ago, I think it was after Sandy Hook, and I don't want to dwell too much on this piece, but I am interested in hearing your thoughts as an American in the field on this. The Obama administration, I think it was them, had created or announced a large mental health first aid training and funding opportunity. I remember reading that and feeling very conflicted. That it's great that people are getting more mental health education, but why is it happening in the wake of a terrible tragedy like a school shooting? Because it's reinforcing that false narrative that there's a connection between, or that mental illness is a predictor of violence, which is not. So on the one hand, you're getting something very good out of it, mental health training, but it's for the wrong reason, kind of.
Right.
So
or that the timing is very interesting. But, we kind of see that across the board with so many things, right? Like things don't get fixed until they're broken, and until they're really, really, really broken. When I was in my training, one of the places that we worked in was a prison facility, and you had patients who had, sort of committed crimes, but also had psychiatric illness. And there were some programs that I thought could have been very helpful, but they weren't offered to people unless they had been hospitalized, 8 or 10 times. And so the question is, why do we have funding and education that comes, or if you think about it, when we think about healthcare dollars in the United States that are spent, they're spent, 7 to 1 in terms of the population, sort of 60s and 70s versus a younger population. So a lot of our money and attention and focus is going on fixing problems way after they've already happened. And I think that's starting very early on. And I think there's more attention. I think as the evidence is mounting that childhood adversity and what we called, these childhood adverse events can cause everything: increased risk of obesity, of stroke, of hypertension, of diabetes, and then all mental health, issues: anxiety, depression, substance, certain personality disorders. So we know that these things happen early on in utero if women are not getting proper prenatal care, if they themselves are experiencing stress, trauma, substance abuse, domestic violence. So really what we're talking about is changing an entire mental health landscape, a whole system, a whole way of thinking. And I think that you guys are way ahead of the game in many ways in terms of like a sort of, I know this is controversial, but giving healthcare, like these are certain basic things that I think as successful as we are in so many ways as a nation and progressive and wealthy, this is what we're missing. Is this
right? Well, I mean, you're talking to a Canadian, so I don't think universal access to healthcare is really that controversial. It seems like a no-brainer.
Well, for us, if you talk about Obamacare or whatever it is, it's always been, but it's
But
lucky.
I mean, well, that's it, though, even in Canada, and this is, I think, indicative of or an example of the historical stigma that's existed. We have a universal medical care system in Canada, but generally there's no fully funded psychotherapy in any province. And many antidepressants, even just basic antidepressants, don't pass government approval for funding on the list of things that they'll pay for. So there's still very real issues with mental health care in particular versus the rest of them. Now,
Yeah,
you still see this in the States too, where there's a division within healthcare. The different color forms, the different hospitals, the different ways of handling people.
Yes, and even with insurance companies, and actually the American Psychiatric Association had a couple of class action suits, and they won with one major insurance company where they were having issues of parity, and they were saying that behavioral health was a separate system, and that there was a cap in terms of how many visits you could have per year, and that the reimbursement was a lot lower. And a lot of my patients will tell you that they're jumping through hoops to get reimbursed, that there are a lot of arbitrary rules, and not just rules, but you'll call somebody and 6 months later a claim for one of your visits has not been reimbursed. And if an average person who might have a job, who might have a life, who's busy, has a hard enough time calling and staying on the phone for an hour or 2 hours at a time, let alone somebody who's depressed. So I feel like there are a lot of barriers to care, and some of them is just accessibility and affordability. Then there's stigma, then there's being able to put the pieces together to get the care. But then once you do, things are not made easy. And I not to go into conspiracy theories, but I wonder why it's so hard to get reimbursed for certain health claims. And
well, I think when you put if you take healthcare out of the hands of being a universal human right that you need to be healthy and put it into the hands of corporations, then of course they're going to have a vested interest. They have a responsibility to their shareholders. That's why that model, I think, doesn't really work in people's interest. But I don't want to put you on the spot because I know that. but that said, though, as a psychiatrist, I mean, there's I don't think as much a division in psychiatry as people think there is. But do you tend more toward the biological determinants of health, more the mental illness as a brain-based disease? In other words, nurture or nature rather, or more on the nurture side, because you've mentioned adverse childhood events as well.
Yeah, I think it's a combination, and it's this idea of like epigenetics, where they were talking about adverse childhood events like affecting a woman. So if you think about it, girls are born with all the eggs that they will ever release in their life, right? And so those eggs that a 9 or 10-year-old girl who's a victim of abuse, we're talking about, genetic modifications basically well before she's in her reproductive years and reproducing. So it's very hard at that point to separate the nature of the nurture, because the nurture is influencing the nature, right? So like as we're talking about generation, or with Holocaust survivors, like, multi-generational trauma. So it's really hard to tease it apart. And I think it's so closely embedded, where if you're born into a home where there's a lot of conflict and strife, and part of it might be because there's untreated mental illness in the family, then you're dealing with nature and nurture at the same time, right? So like in terms of, I think parenting is hard enough, but then if you add in mental illness, and I think a lot of children that I see, or young adults or adults, will talk about, frustrations from their childhood and unmet needs. I think that goes across the board, whether your parent had mental illness or not. But a lot of people are talking about how there was untreated mental illness in the home. So not only do you have a biological predisposition to getting mental illness because a parent or family member had suffered themselves, but then also because of the home environment that was perhaps created as a result.
And that seems to me to be a bit of a tough nut to crack, because if you try to intervene from a public health perspective or as a professional, parents understandably feel defensive. Are you saying that my depression caused my kids' depression? Well, no, nobody's saying that. That I'm reminded of this idea in dialectical behavior therapy of acceptance and change.
Yes.
That when you're depressed, you might be more withdrawn and you might not be as emotionally expressive with your kids.
Absolutely.
Just accept that as a fact without judgment, and now we can change it. There's no judgment there.
Yes, I love that. And I'm so glad that you referenced DBT because I'm such a huge fan of it. And I'm such a huge fan of, basically psychotherapy and this also the psychological aspect of it. So I feel like you can't teach, like they all work together to inform a person. So, anytime you would take a history, you would do a bio, psycho, social, legal, medical history. And that's what I love about being a psychiatrist is that I'm just as concerned about a person's inflammation in their body in the form of elevated cholesterol or diabetes and thinking about their arteries. And I'm thinking about their arteries because of, for example, vascular dementia, which a lot of people end up having these symptoms, but they're not having cognitive symptoms, so nobody picks it up. So if somebody is telling me that I've untreated hypertension, I'm concerned about it. I also
thyroid, diabetes, asthma, I think has a connection.
Exactly. Asthma has connection with anxiety and COPD. So all of these things, they sort of go hand in hand. So, telling somebody, okay, let's get some of the tests. Have you seen a primary care doctor? And then also being able to offer psychotherapy, that whole idea of like, if all you have is a hammer, everything is a nail. So like there are some doctors that are only writing prescriptions and they're not necessarily thinking, or there's some people who wouldn't necessarily think, oh, this person could benefit from medication. Can I send them out, for psychopharm? So I feel blessed to sort of be able to integrate or have the tools and then also know when I don't know the answer and be able to feel comfortable to send someone to a second opinion if needed.
So the last thing I'll ask you, because I told you I wouldn't keep you too long, and I said this to every guest so far because I'm just so fascinated by everybody. But anyway,
thank you. Great chatting with you.
The last thing that I'll ask you about is, lots of people have negative experiences with the formal mental health system, whether it's through hospitalization or disorganized systems of care where they don't know what door to go in to, or professionals who maybe aren't as empathetic as they could be. Sometimes I've heard it as a community level advocate so many times, people will try once or twice or even 6 times and then give up because they feel like the system isn't designed to help them and they lose faith. So what would you tell as sounds like a well-rounded physician in a lot of respects, what would you tell those people who have had negative interactions with the system but still need help?
Yeah. So I would say, listen, like just the way you were saying about acceptance and also change at the same time is accept that maybe you need to take a minute to breathe because a lot of people will say, I'm so tired of struggling. And then that's where I would say, ask for help. Ask for help from a family member to say, could you refer me to somebody that's good? And this is where the whole stigma component comes in that why are we more likely to share the name of a restaurant to a friend, or a manicurist, rather than I had an amazing experience with a therapist. If and when you ever want to talk to somebody, please talk to this person. Because I think so much of it is finding the right connection. I think that when it comes to major life decisions, I want people to think of finding the right therapist as almost finding the right partner in life, right? So I want people to feel empowered. Practical advice that I would give in terms of finding a warm, empathic, supportive therapist that will also push you to change is you can interview them. So many people think of this as sort of a passive approach that I'm at the mercy of the therapist and the doctor, and then they stay just the way you would stay in a dead-end relationship with a partner. They end up staying in dead-end relationships with therapists because they don't want to hurt the feeling of the therapist. So, we could do a whole talk on how to find a good therapist, how to know it's a good fit,
and how to break up with your therapist. That'd be a good one.
Exactly.
Unfortunately, we don't have time to go into all those fascinating issues, but I'd love to have you back sometime. Dr. Sudeepta Varma, where can people find you in the fabulous work you're doing?
Oh, thank you so much. So I'm on social media, on Facebook, on Twitter, on Instagram, LinkedIn, and look for me, drsuvarma.com. And I'd love for you to follow me at Dr. Sue Varma, Twitter, any of the social media channels, and please follow, and we can continue the conversation on stigma. Thank you so much, Mark, for having me.
Thanks so much.
Thank you. Take care.